Good afternoon, everybody. This is Dr. Jeff Culbert from Schooley's Mountain Chiropractic Center, and today we're going to do a little bit of an educational video. I know it's not as exciting as an adjusting video, but in previous videos we have gone over the different phases of care in the office, and those are being that of basically relief care, just putting out the fire, making you feel comfortable. That of corrective care, making what is weak not only relieved of symptomatology, but stronger, so that the likelihood of it coming back in the short term becomes more remote. People who typically go through corrective care generally tend to experience that the problem does not return for 5 to 7 years, so a big bang for the buck that you're spending to get to that point in care. And then there's what is known as long-term wellness care, supportive care. In the very old days of chiropractic, they affectionately known it as maintenance care, but I don't like that expression. I like the term that it is wellness oriented, that if you do enough of the things right in conjunction with your wellness care in terms of exercising, eating well, watching your posture, maintaining a great attitude, you're a lifelong learner, you're mentoring others, you're connected to a higher purpose. It's not maintaining, it is actually helping you to thrive, develop a greater level of health and fitness, okay, those things that will allow you to do what you want to do, where you want to do it, whenever you want to do it, with whomever you want to do it, as often as you would like to do. So I thought I would take the time today to show you some evidence based on x-rays in terms of what can happen to you when you're coming in for a progress of just relief care, and what can happen when the problem does come back. What does the spine look like when we go through a process of corrective care, which in many cases can last months to years, and then what goes on with long-term wellness-oriented care. And the x-rays that we're going to go over are going to be showing you what a normal looks like. What does it look like when a patient comes back in for relief-oriented care, goes away for a little while, and then ends up having an accident and we re-x-ray because of trauma, what that spine looks like, because all you did was relieve the problem, not get it corrected, so the forces that got the problem to start to wear and tear originally just make things worse. Then we're going to compare that with somebody who went into a wellness program of care or a corrective program of care and was in an automobile accident. You're going to see what her neck looked like and what it looked like 10 months later. And then you're going to take a look at a little bit of an older woman, 58 years old, coming in with degenerative disc and pinching and arthritis. And then again, after about 10 months to a year's worth of care, what happened to change to give her enough of a difference that it was a significant impact for her in her life. So without any further ado, what I'm going to do is show you, this is what a normal x-ray looks like. What you notice is there's a beautiful C-shaped curve going on in the neck, and that C-shaped curve is there to act as a sponge or a shock absorber, so that as gravity, the weight of your head, and the activities that you're doing, it acts as a spring, so that all of the joints and all of the discs are not wearing out prematurely. So that's what normal looks like. So we're going to take this x-ray down and I'm going to pop up what happens when a patient is going underneath a program of just relief-oriented care. So this was a young woman. She was in her mid-30s at the time. And what we're going to end up showing you is this was her x-ray. Okay, you can notice that there's a big difference between that x-ray and the x-ray we just had up, in the fact that this spine is too straight and it is leaning forward, a little bit of forward head carriage, which is very common today with computers and cell phones and pads and other devices that we're always keeping our head cocked forward for. So this young lady comes in for relief care as a result of an automobile accident. And what ends up happening is she got relief and she left our office. So you notice that there's a little bit of compression going on at C6 and C7 with only 6.5 millimeters of space separating. If you look up above just a little bit and down below, you'll notice that the space between those vertebrae are a little bit wider than it is between 6 and 7 with 6.5 millimeters. What happens to this young lady is 4 years later, she's down at the Jersey Shore. She dives into the ocean head first. A wave happens to hit her and slam her head into the bottom of the ocean. Comes back to our office complaining of neck pain. Because of the trauma getting her head slammed into the bottom of the ocean and hitting the sand, we re-x-rayed her. So you'll notice that the neck is a little bit more forward. It's still straight as a rod, which it shouldn't be, but you notice the difference between C6 and C7 on the left-hand side versus C5 and C6 on the right. There's a little bit more of arthritic spurring setting in, and there's only 5 millimeters of height that has gone on. Now, the difference in time was 4 years, but in as little as 4 years, that degenerative process that occurred from the original car accident just kept going because there was nothing that was done to end up correcting and solving her problem, making it stronger. So her forces of gravity and the activities of daily living just progressed to have that condition slowly get worse over time. Now, she's also 4 years older, but with that degeneration and that arthritis and compression, it also took her much longer, that second go-around, to end up achieving relief. And then she ended up going through a little bit of corrective care before she ended up moving out of the area. We have a patient here, again, a woman in her mid to late 30s, is involved in a car accident. And what we notice with her, again, an extremely straight neck, which is not uncommon post-trauma in a whiplash injury. So she starts with us under care, and 10 months later, you start to notice that the curve has started to come back into her neck. So again, this is incumbent upon us because if the neck stayed too straight over time, gravity, the weight of the head, the activities of daily living, and head position would eventually cause those discs to want to degenerate and start to compress. With that curve coming back in, she's got a greater likelihood of having a spring in that neck and not allowing those joints to degenerate and the disc to compress and start to create some pinching on the nerve. So again, this took 10 months to occur to restore that curve back to normal. And this patient still continues to come in every 2 to 4 weeks, get her adjustment, and is doing absolutely well and is thriving now as not only a mother of young children, but now a mother of kids that are all out of college, all thriving. She's doing great and still able to do her thing as a dental assistant. Now, this is a patient that underwent long-term corrective chiropractic care. She was 58 years old when she came in because of hurting her neck. At 58 years old, you are well past skeletal maturity. So skeletal maturity generally hits around 34, 35, 36 years old these days. So before the skeleton is matured, okay, we can often make a lot of great changes. So the women that you had just seen were in their mid-30s, right around the ages they're just starting to hit skeletal maturity. The woman that we're going to show you now is 58 years old. Okay, so she's already got a straight neck and she's got a level of disc degeneration with some arthritis going on. When I pop up the x-ray, you're going to notice she has about 4.5 millimeters of disc height. Now, after a year's worth of treatment and care, we re-x-rayed her. And what we noticed with her is that the curve did not come back. And that is not unusual for somebody that is in their late 50s, 60s, or 70s. Again, mostly because they have reached the age of skeletal maturity, and it's just way harder to get those curves back when the skeletal system is that mature, okay, and very much locked into the pattern. But we ended up doing with this patient is that we were able, with exercises and getting adjusted, and the key to a lot of this stuff is making sure they are hydrating a lot with water. Not coffee, tea, sodas, or alcohol, but water. The first drink that God made for us. Because when you're drinking and consuming enough water, and you're able to open up those disc spaces, free up those fixations or subluxations, and get some distraction going into that neck, you're reversing the pressure. So again, as you're reversing the pressure and opening up, instead of compressing and squeezing out, you're opening up so that the water can suck into the disc. And if enough water can suck into the disc over time, then you'll start to see the process called imbibition. And again, I don't care if you remember that, but it is a fancy medical term. Over time, as the disc starts to absorb water, you will start to see that you end up increasing disc height. And we ended up increasing disc height on this patient by about 1.5 millimeters. Now you say 1.5 millimeters is not a big deal, but for this patient, you opened up and took the pressure off the nerve going down into the hand, creating the numbness, tingling, and weakness. That you took the pressure off and it made a significant difference for her so that the numbness and tingling started to go away and then the strength started to come back in the hand, which made her able, at a 58-year-old woman who has grandchildren, to engage and do the things with her grandchildren that she wanted. So when we pop up the x-ray, you'll start to notice here, again, sorry for a little bit of the poor quality, but between 5 and 6, she's got 4.5 millimeters, okay? Now what we've ended up doing, there's really no improvement in the curve, and there's no taking away the arthritis, you can't do that. but now she's got 5.5 millimeters of height, opening up the space where that nerve is and taking the pressure off the nerve. So again, as we went through with her the process of relieving her symptomatology, taking the time to strengthen and stabilizing all the supporting musculature around that area of the neck, and then going on to doing long-term wellness-oriented care, we were able to, over the course of 1 year, significantly reduce her pain, her numbness, her tingling, and the weakness. And this patient stayed with us as an active patient from 1997 all the way through 2006 before she moved out of the area. And then again, enjoyed the benefits of long-term chiropractic care. And when she moved out of the area over into Pennsylvania, not only did she leave with great results in our office, but we also assisted her in finding the chiropractor that she then continued her chiropractic care with. Because again, as I love to say, not only we are superb at providing relief care and corrective care, we love to think of ourselves as a center or a clinic where our philosophy is we get you well, we keep you well with a lifetime of care and service. And if that's staying in our office for 20 or 30 years, because we just celebrated our 31st anniversary here and I have patients that have been with me since day one, or it means you're moving out of the area because there's a lifestyle change and we can assist you in finding somebody who's going to be great and continuing your chiropractic care, we take on that responsibility for you. So again, I hope you found this information useful today to understand what are the concepts behind just relief care, what's the concept behind going beyond relief care to corrective care, and then ultimately protecting that whole time and investment with something known as wellness-oriented care, so that again, not only you're just relieving the problem, correcting the problem, but you are actually making your body better than it was than before the problem was there. Not just surviving, but actually thriving, okay, and building onto a healthcare spectrum that is going to try to get you. And remember, I love to quote the book of Genesis in chapter 6 where it says, God granted us 120 years. The problem that we're facing today is we at one point in time had a maximum life expectancy of 79 years, and over the course of the last 4 years or so, our life expectancy has gone from 79 to just over 76. And the problem with that is we have more people, okay, from the baby boom generation that are now pushing into their 80s and 90s and getting into the 100 range, but we're also sacrificing the life of our Gen Zs and our millennials because they're not living nearly as long. Things like fentanyl, things like opiates, COVID, and all this other crazy stuff that has gone on in the last 8 to 10 years means that the life expectancy of our younger generation is going down while the older generation is still finding a way to thrive and get to 100 years old. So I have a problem with that. So again, I'd love to have as many people under long-term wellness-oriented chiropractic care. Study out of Canada back in the mid-90s found that chiropractic should really be a part of everybody's healthcare arsenal or part of the healthcare team, and that you should always see a chiropractor first before you start to rely on drugs, which all have side effects, and then going on to surgery where the body is literally altered and changed, either due to doing surgery, removing something, taking a part of the body out, like I had a shoulder replacement due to trauma years ago. So my shoulder is totally altered from what it should be. I have great function with it, but it's never going to be as strong as it once was, but I can certainly use it and thrive by continuing my chiropractic care, both for getting adjusted, getting therapy, watching my nutrition, monitoring how I exercise, watching my posture, maintaining my great attitude, and then just being a mentor to others and constantly learning how can I not only make myself better, but my mind, my body, and my spirit. So this is the kind of the things that we talk about at Schooley's Mountain Chiropractic Center when we're talking about long-term wellness-oriented care. So if you found this interesting, please hit like, please hit subscribe and share this with your friends and family so that they can get the same information, like and subscribe and pass it on, and we can go, that age-old thing with the old hair commercial, I told 2 friends and they told 2 friends and they told 2 friends. So the more we can get the message out there that chiropractic is great, it's safe, it's effective, it has something like an 87 satisfaction rate with the patients versus a 46% satisfaction rate with MDs. So again, I'd love to get the word out there. So this is Dr. Jeff Culbert saying thanks for listening and learning a little bit more about the difference between relief, corrective, and wellness-oriented care, at least as how we practice here at Schooley's Mountain Chiropractic Center. And I promise we'll get another adjusting video out, hopefully within the next week or 2. In the meantime, you guys have a great day. Thanks for your attention. We'll see you soon in another video.